I want to go to my next guest. It is Dr. Nadia Alam, who's on the front lines during this pandemic. She's an on-call anesthesiologist, and is treating COVID-19 patients. Nadia joins us live from Georgetown, Ontario. Doctor, nice to see you.
Thank you very much for having me on the show.
Anesthesiologist. It's hard to say a couple of times. Listen, I wanted to get you on the show because of a tweet you sent out last night that caught my eye, and I have to say made my heart sort of twinge a little bit too. This is a picture of you in your gear after a very long shift. Can you tell us a little bit about what happened last night?
So like the other GP anesthetists and like other anesthesiologists around the province, I was on call and working in the OR, going to stat intubations, putting patients on life support, that sort of thing yesterday. It was a 24-hour shift. I was in the hospital for about 10 hours. It was a very long day, I have to admit. But it's good work, it's important work, and this one patient stole my heart, and that's in that moment of desperation and sadness and hope, I tweeted, and I'm surprised by the response to that tweet.
So you were coming off this very long shift, doing very hard work, and this older gentleman, he asked you for what? Well, how did he capture your heart?
So I was called in to intubate him. He's an elderly gentleman. He's got poor lung function. He's got COPD and a number of other illnesses that make him quite frail. He'd been brought into the hospital because he needed extra supportive care, so supplemental oxygen to help keep him stable and keep him well until he could recover from COVID-19. There is no cure for COVID-19. The reason I was called was he was worsening. He was getting sicker. If he wasn't put on a ventilator, it wasn't clear whether he would survive or not. Now, I want to be clear, being on a ventilator is not a cure for COVID-19 either. So I geared up, went in to intubate him and put him on life support. And as we spoke, as I got his consent, he realized that there was a high chance that he would end up passing away. He would end up dying on the ventilator, and that is not how he wanted to go. That was not how he saw all of this playing out.
So you sat with him for a little while?
Yes, he turned to me and said, if I die from this, I would rather die looking at the sky. I would rather die talking to my family. And so I sat with him and we looked at the sky, and it was a beautiful sunny day. And we talked about his family, and he put his family on the phone so that I could talk to them too. And like I said, yesterday was a hard day, but that time with him was probably the most peaceful moment that I had.
And did he end up going on the ventilator, or he decided he just didn't want to go down that road at all?
No, he told me he didn't want the tube. I went back to see him again this morning. He's sicker this morning. And we talked again, and he still understands all of the risks. He's made an informed decision. He realizes that he's had a really good life. He realizes that he's very seriously ill. He knows that he could pass away from this, but he wants to go out on his own terms. And so that's what we're giving him.
So how are you doing in the midst of this? This is one story, but you're seeing many, many stories right now.
Yep. This morning, after I saw him, I went on a couple of house calls. One of my patients, she's elderly. She's also very frail. I apologize. My kids are in the background.
No, it's all good. We're all dealing with it. Don't worry.
She's very frail. She's disabled. She's essentially bedbound. And I went in to see her because her husband called me. He's her primary caregiver. He's working really hard to take care of her and keep her safe, keep her at home. Everybody's very careful around her. But she started having a fever this morning. She started having a sore throat this morning. And I went in to see her because I was worried that she might actually be developing COVID-19. Patients who are elderly and who are frail or who are complex, she's on immunosuppressants, they don't present with the usual fever, cough, shortness of breath. They present in other ways. They could present with falls, they could present with hallucinations, they could present with weakness, they could present with sore throats. So now we're watching and waiting. I love this family. I'm very nervous that if it is COVID-19, it's not going to look very good.
You know, like so many healthcare workers, I asked you sort of how you were doing, and like many frontline workers, you started talking about patients, and I know that's sort of the way you guys are trained. But I hear the kids in the background. I know you're putting yourself at risk every day. How are you doing? How worried are you about your own health and your kids?
I'm scared. I read an article today about a physician who had urged his country to provide proper PPE, personal protective equipment, for frontline healthcare workers, and he passed away. So I know that the work I do, it is incredibly important. I love it. I love being a doctor. There is no doubt about that. I have never understood this more clearly than in these days, but I'm scared. I'm scared because I'm afraid of catching the disease. I'm afraid of passing it on to my more vulnerable patients. And I'm afraid of being one of the statistics that passes away from it. I have to admit that. I am afraid. And my kids, they feel it too. A couple of days ago, my 6-year-old turned to me and hugged me and said, "Please don't die." And that was really hard, talking to him and making him understand that I'm young and healthy. I'm probably going to be fine. And he was like, "But you talked about other people who were young and healthy who passed away." And I had no answer for that. So all I did was hug him. I just sat there holding him until he stopped being afraid for a little while. We're all trying. We're all trying very hard, but these are not easy times.
No, they are not. About personal protective equipment, I saw last night in the photo you seem to have what you need, but do you need more? Are you concerned about that part of it?
We don't have enough. My hospital has enough for now. We don't know when the next supply is going to be coming. We don't know where it's going to be coming from. So there's an incredible amount of uncertainty around it. There are some hospitals that are at imminent risk of running out. We are all saving our used masks in the hopes that Ontario Health will be able to figure out a way to reprocess them, resanitize them so that we can continue using them. In the communities, it's even worse. So I not only do anesthesia at the hospital, I'm a family doctor in the community. That's why I was doing house calls this morning. So I do everything from cradle to the grave care. A lot of my colleagues have no PPE left. And that's why some of us, like me, are running community drives, trying to get masks from nail salons, gloves from factories, gowns from people who are at home who can sew us reusable cloth gowns. We're trying to get enough PPE going. And my hope is, and this is kind of my plea to the government, to all levels of government, I know you're working hard to get us the personal protective equipment that we need to be able to do our jobs properly. I know that you're focused on the hospitals. Please don't forget the communities, because that is where we take care of our pregnant patients. That is where we take care of little kids. That is where I take care of my patients with heart failure and cancer, for pain control. That is where I take care of my palliative patients. Mm-hmm. Please don't forget the communities.
I've got a briefing that I have to get to, but let me ask you one last question. What would you say to Canadians? You know, we're being told we're in the beginning of this. We've got to buckle down for many more weeks. What would you tell Canadians?
Keep faith. This is working. The social distancing you're doing, the hand washing, being careful, it's making a difference. Please continue it. I know it's hard. A lot of people have lost their jobs. A lot of people are struggling from just the isolation, the mental challenges of being stuck at home by themselves. I've had patients who've broken down on the phone about it with me, but it's worth it. It is helping. please stay safe and keep faith.
Well, Doctor, same to you. Stay safe, keep faith. I knew when I saw that tweet last night that you would be more than good to talk to, and thank you for being so honest and so personal. And listen, I wish you lots of courage going forward. Thank you.
Thank you.
Dr. Nadia Alam in Georgetown, Ontario.